Hello, everyone. This is Grace Wong from the Chinese University of Hong Kong. I'm very pleased to share with you our newly published review article entitled Statistical Strategies for HCC Prediction Models in Patients with Chronic Hepatitis B. HCC prediction models or risk scores has been a very hot topic in the last decade. There have been a handful of various HCC risk scores been derived, validated, and published. We can grossly divide these risk scores into two types. One is mainly derived and validated for untreated patients, and the other type would be mainly specially derived for treated patients. In fact, there have been various statistical tests or strategies involved in the derivation process of these risk scores. So listed here, the common statistical approaches include the conventional Cox proportional hazard model. So in this approach, various type of clinical characteristics or covariate will be included in the multivariable models, and they will be identify those independent predictors of HCC. And we also using the linear trend chi-square test to really assign a weight to that particular factors. So if the factor is more important, the weight assigned to that characteristics or factors will be larger, and that will be assigned a heavier weight or score in the risk score formula. Sometimes we also use the Yoden's index to identify the optimal cutoff to have either high sensitivity, specificity, or the highest sum of these two important characteristics. And we very often also involve some point system because that would be easier to be applied clinically. For example, like in PHP score, each characteristic would be assigned for various points. When we added them together, then we can get a sum of the score, and the score will be easily stratifies our patient into different level of HCC risk. Usually will be low risk, intermediate risk, and high risk. So in this review article, we also listed out all the formulas of these risk scores. So you can take a reference on that and find the score which will work best for your patient in your clinical setting. So thank you very much for your attention.